I was semi-retired, and when COVID came, I was really bored. I thought I would really enjoy learning to become a nurse practitioner. I really wanted to focus on rural health and underserved populations. 3 years later, here we are. Because I had parallel careers in business already, I went ahead and opened my own practice, not knowing what I didn't know. Talk to anyone that would listen, let them know that I was open for business. I mentioned it in my Rotary Club to some of the people that are there, and here we are. I think I have 400 patients now in less than a year. Trusting my staff and delegating the things that they're able to do that will save me time and allow me to see more patients and give the patient the quality time that they need. I think anybody can do it if they've got the desire, the motivation, and the willpower to make it happen. You really have to want it. It's how you react to those that really are going to make you successful or not. I love what I do every day. I come in here with a smile on my face and I leave with the same smile, and I wouldn't change it.
Welcome to Unsung, the podcast powered by Duet, where we shine a light on the nurse practitioners who are breaking barriers, redefining healthcare, and proving that NPs aren't just the future, we're the now. I'm Dr. E, and in each episode, we'll uncover the untold stories of NPs across the country who are changing lives with their practices, making a real impact in their communities. And today's guest is Frank Rosenberg, a brand new NP who didn't wait years to get experience before launching something bold. Just 10 months out of school, Frank opened up Tempe Primary Care in Tempe, Arizona, a practice that is making waves by serving all ages, especially those who often fall through the cracks of our healthcare system. What makes Frank's story so compelling is that he leaped into practice basically out of NP school, and he created a model that puts patients before profits. He built a practice that puts accessibility and affordability at the center of care. Let's dive into how Frank made the leap, what he's learning as a new practice owner, and why sometimes being new is actually your biggest strength. Frank, I'm so excited to have you on this podcast. Thank you for being here.
Thank you for having me.
Of course. Okay, so this is Duet's podcast, and it is all for NPs who are either entrepreneurs or aspiring to be entrepreneurs. But before we get to the entrepreneurial part, you have to tell us why you became an NP to begin with.
Yeah, so I was semi-retired, working dual careers for over 30 years in both nursing and business. And when COVID came, I was really bored and I wanted to continue learning. I didn't want to just sit at home and not do anything. So I went back to school and I thought I would really enjoy learning to become a nurse practitioner. But I was specific about which program I chose because I really wanted to focus on rural health and underserved populations. So 3 years later, here we are.
So your aha moment, did you have like a particular aha moment, or was it just like, something, a calling that you...
I can't say that it was really an aha moment. I think I was looking for something that I would enjoy, that I could be passionate about, and not have to worry about how much money I would earn or what would come of it. I just wanted to learn and see how it goes, and I really enjoyed what I was doing. And when I decided to open my practice, it's very cool.
Yeah. So were you a nurse practitioner first, like working under someone, or you went straight to open up your practice?
So because I had parallel careers in business already, I went ahead and I just opened my own practice, not knowing what I didn't know.
Oh my God, I don't think anyone knows what they don't know, right? That's the crazy reason why we do it. What was your previous business?
I have an American Heart Training Center, so we did a lot of healthcare education. I've got a real estate brokerage, which is very different than healthcare, and I worked as a business broker overseas in England for quite a while.
I love that. So you became an NP, and then the very next day you opened up your own spot?
Well, I had to get a license first, yeah. So I got board certified, and once I was able, I picked a location and opened up shop, and it took a while to get some patients, but once we started getting patients, it really snowballed.
Yeah. How did you get those first few patients?
The first few patients was word of mouth. I talked to anyone that would listen, let them know that I was open for business.
Yeah.
So it was a handful of people. I'm a member of the local Rotary Club here. So I mentioned it in my Rotary Club to some of the people that are there, and they ended up sharing and spreading the word. Here we are. I think I have 400 patients now in less than a year.
Oh my God, that's amazing. When you first started, what was the thing that kept you up at night?
I sleep pretty good. So
So when you first
nothing really
started, there was nothing that was getting you worried?
So yeah, I slept pretty good. I felt pretty good, but you're always, any business owner, you're always going to wonder, is it going to work? How is it going to work? What do I need to do to make it better?
Yeah.
So those are the things I would think about, but it definitely didn't keep me awake.
It didn't keep you awake. Okay.
No.
How did you fund yourself? Did you keep your other business for a while until it took off? How did you?
Yeah, so I still have my other businesses. I think we have four businesses currently that are self-sufficient. We've got managers and they run. So that provides a steady income for me. I haven't actually paid myself yet since opening. So I'm keeping everything kind of in the account for a rainy day for when we need to grow and expand. So we prepare. We don't have to borrow money. So we
Yeah.
were self-funded, but we also planned ahead. Once we realized we were going to be opening a practice, we started buying a little bit at a time. The smaller stuff that we could store, we shopped at Goodwill, at local auctions, and surplus at the local colleges where we could get bigger items like exam tables and
Mm,
computers and the things that we knew we were going to need, so we could get it at an affordable price. We rarely bought anything new.
that's great. So you surfaced a few things. On the first hand, many of our NPs will say the same thing. In your case, it's other businesses, but almost all our NPs will keep their other job until this takes off. So in your case, you kept your other businesses, which is really good because a lot of people feel like they have to stop everything to open, and that's not the case. And what we hear again and again from all of our people that work is that they kept something going on, some sort of full time or side time kind of thing going on. And the other thing that you're surfacing, which I want to make sure our listeners hear, is that the practice doesn't have to be new, out of the box, gorgeous. A lot of people think like, well, I have to have so much money because I have to have this top of the line office, and that is not the case. It could be a small area. You're talking Goodwill. Our first exam tables were like massage tables. You know, they just need to sit somewhere. There doesn't need to be anything. The care is the care. So I love that because I think it's really important for people to hear. We recently mentored someone. He's like, wow, I'm going to need so much money to open. I'm like, you need a stethoscope. Like, you don't need much in primary care. We're not, doing procedures. So I'm glad that you picked that up. So you got 400 patients at this point. So how many do you see a day?
So yesterday was my busiest day so far, and I saw 20.
20, nice. Okay.
Yeah.
Is that where you want to be? Do you want more a day?
If I could see 20 patients every day, I think I'd be pretty happy.
Okay.
Obviously, there's room to grow. I could have easily seen another 5 or 10 yesterday with the support staff that we have. So it went pretty smoothly, and everybody was happy. Everybody was still alive and well at the end of the day. So
Sure. What is a usual day for you if 20 is a lot?
around 15 to
15.
16.
Okay.
But it's growing. We're seeing right now, we're seeing at least 15 new patients a week.
Amazing.
And so I think this week we're up to 20 new patients for the week.
Amazing. And where do you
So
get your
it
new patients?
snowballs.
Yeah. Where do you get your
Yeah.
new patients from mostly?
Well, it's word of mouth. We don't pay for any advertising at all. We
Okay.
have our regular Google page and a website,
Okay.
and our patients come in, they have a good experience, and they tell somebody they know. So you
Amazing.
start to get that exponential growth.
Yeah. So you don't use ZocDoc or anything like that. It's just all word of mouth.
We're in the process of setting up ZocDoc to fill any of our open space in the schedule. But the schedule has been pretty full, so there's not a lot of room to put ZocDoc in there just yet.
Okay. I love that. So, going from 0 to 400, what is, a habit or a system that you implemented that's kind of been a game changer for you?
Trusting my staff and
Mm.
delegating the things that they're able to do that will save me time and allow me to see more patients and give the patient the quality time that they need to address all their concerns.
Understood. And so what does that mean, trusting your staff? Like where was that hardship there? Give us like a case study.
Well, I think you have to surround yourself with good people that you trust. And as in any business, not just a nurse practitioner owned practice, But my staff I don't have MAs, for example. I've got two RNs and a paramedic that work with me. So I have an ICU nurse and an ER nurse running the front and back office for me, with a paramedic doing, blood draws and stuff like that. So I've known them for a long time.
Mhm.
So I know their skill set, know their background. So I'm comfortable with them taking on some of those tasks that I normally would have done myself, that don't require a nurse practitioner to do.
Yeah, I think that's really important. Working at the top of your license, right? That's what we call it.
Yeah.
Making sure that you're not doing anything, that you should just be walking into the room and doing your clinical decision making. The one thing that that the rest of your team can't do. I think that's really important. It also um, allows you to see more patients because you're not doing things that other people can help you to do. But not everyone is good in delegating, so that's great that you're able um, to delegate. Do you feel like you have to balance the clinical time with like managing the business time?
So during the day, I take care of patients. I usually come in 1 or 2 hours before my staff arrive in the morning to take care of the non-clinical business.
Hmm.
So I'll do the bookkeeping. I'll do any of the maintenance or repair items that need to be done. I'll review my schedule. I'll make sure that everything is taken care of. So when everybody hits the door running, I'm right there along with them, taking care of patients.
So you balance it by doing it before work.
Absolutely.
How about on the weekends? Are you balancing things from the practice on the weekends?
I don't take work home with me.
Okay, so
So
you finish all
when
your
I leave at the end of
charting
the
and
day,
everything.
absolutely, I finish my charting on a daily basis. I don't carry over. So I'd rather stay until it's complete and start, the next day fresh.
Fresh.
So I have my weekends, I have my evenings.
That
So
is,
it's really nice.
yeah, that is really nice. What makes your practice different than other practices in the area?
That's a good question. I'm not too familiar with the other practices in my area, but my patients tell me that they like coming in because they feel heard. They feel like I really care about them, and they love not just seeing me as a provider, but also interacting with the other people here in the office. So I think we've got a friendly atmosphere that people enjoy.
Understood. But what about, you seem to describe something that's really smooth, which I'm really happy about. Were there any challenges that you faced when you started your practice or?
Yeah, I think the biggest challenge for me was understanding billing and coding and
Mm,
just getting credentialed with insurance companies.
yeah.
Because my clinical time when I was at school, I worked in a practice that was direct primary care.
Mm,
So there was no insurance, there was no billing, there was no coding. Everybody just came in, they paid a membership fee, and they got unlimited visits. So that's what I thought I would be doing here in my practice. But I quickly realized, being in the middle of the city, that a lot of people have insurance and want to use it, even if it
sure.
costs them a little bit more money. So I think that was the biggest challenge for me. And it still is. It's just maximizing the billing and coding for the patients, and not having learned that prior to opening my practice.
So how did you learn all of it?
So it's still a work in progress, but it's a lot of self learning and relying on colleagues and outside resources. We have a billing company that helps us, so they've been great, and they help me quite a bit. I recently signed on with Duet,
Amazing.
and they also give me good feedback on my charting and what I'm missing, where I could have built more for patients. I rarely can build less, but it could always add something on that maybe I didn't think of.
That's great. Are you using their dashboard?
So it just got finished, so I haven't used it yet, but I saw it for the first time this morning.
Yes, you're going to love it. We use ours all the time. It is a game changer. It's nice to be able to have it at your fingertips. Are
Yeah.
you the only NP in the practice at this point?
At this point, yes, but we are already talking about bringing on another provider and possibly opening a second location here in the next few months.
Oh, I love that. Like, like further away. Like, what would be the criteria for the
Yeah,
second?
yeah, it's in a neighboring city, so
Mm,
it's a different demographic, and I think there's an opportunity. I really like the direct primary care model, as well as seeing traditional insurance patients. So I think if I open another location, I can focus on small businesses that maybe can't afford insurance for their employees, but still want to offer something to help them out.
Yeah,
So I think we can incorporate some of that into a new practice location as well as the local demographics.
I love that. So, the people listening to our podcast are usually in the beginning stages or thinking about it. What piece of advice do you think you would give them?
I think the best piece of advice I would give to opening your own practice, honestly, having been through it almost a year now, is get a year or two experience as a nurse practitioner um, prior to trying to open your own. Unless you have a really solid background and had great clinicals and are very confident in your skill set and know exactly how to do the billing and the coding. But it's been quite a long process to learn, and we really didn't start having a lot of volume until probably 6 months in.
So, you say that, but you didn't do that. So, what did you experience that makes you feel like you would prefer to have stayed on before opening up your own clinic?
Yeah, I mean, I felt confident on the business side because I've owned businesses, I've operated businesses, and I've helped people buy and sell businesses.
Hmm.
So I felt like I could handle the business side of a practice. Uh, but I never worked as a nurse practitioner, and I had been out of the hospital for a few years. I was mostly retired, so I didn't have recent clinical experience, and I didn't. I only had one clinical rotation. It was the same clinical rotation for the entire year of my last year of school. So
Mm.
I wasn't exposed to as many places or as many patients as I would have liked to feel confident. So I would see something come into the clinic and I wouldn't be 100% certain. So I'd look it up like a good nurse practitioner should. And I find myself now not having to look as many things up as I recognize what I've seen before.
Sure.
But when you start out as a new grad, you might not recognize and you're spending a lot more time looking things up. And it takes time to build that confidence and experience, really.
Yeah, absolutely. Okay, so you're saying, it's not so much the business side to kind of wait. It's more about get clinically better before you do this on your
Yes,
own because you have no one to ask.
that's right.
Yeah.
There's nobody here for me to go
There's no
knock
one
on
to
the
ask.
door.
Yeah.
I need to make sure that I'm taking the best care of my patients that I can, doing the
Yeah.
best job for them.
It's true. Like that a lot of people are scared of that feeling of it's just you on all fronts. It's just you on the business part and the billing part, on the clinical part, and you have to kind of figure it out on your own. So I think that's solid advice. You about to say something?
No, no. I think anybody can do it if they've got the desire, the motivation, and the willpower to make it happen. I
Yeah.
think that takes a unique personality and background to be successful at it. You really have to want it, you have to love it, you have to be passionate about what you're doing to make it work. Because you're gonna find challenges and hurdles and upsets. And it's how you react to those that really are gonna make you successful or not.
Without question. What do you think are some common misconceptions about owning your own practice?
You're gonna make a lot of money. So, like I said, I haven't made a penny yet. For
Make a lot of
me,
money and
uh,
take and work less.
yeah. Now you're going to work a lot of hours, and
Yep.
you're going to be the last one that gets paid.
Yep.
So I chose to have highly skilled staff here because I wanted to make sure that they were fully competent and I could trust and feel good that they're here supporting me.
Yeah.
But I could save money if I went and hired an MA instead of an RN. I could save a lot of money, but the turnover is higher. And then you're going to be spending time and money retraining people. So I think, yeah, you're going to make money eventually as your practice grows,
Hmm.
and that's good that you don't have so much at the beginning because you can grow and learn at the same time. You can build that practice a little bit at a time. You don't want to build it so big and so fast that it comes crumbling down on top.
Sure. Absolutely correct. Absolutely correct. So, besides the clinical piece of you know, um, when you tell MPs to make sure you get more clinical under the belt, is there any other advice specifically around business that you would give?
Well, you have to make sure that you have a good business plan, that you understand what your goals are, Because if you don't have a goal or vision where you want to be, how are you going to get there? My goal is to build an amazing practice. And we're on our way to doing that. I'd like to get up to 1,000 patients by the end of my second year. I'll probably be able to do that by 1.5 years in. And I'd like to get another provider in here to help out and build another location, same built this one. So that's my short-term goal. My long-term goal is just as important, is to have an exit plan. So I want to make sure, on my timeline, because I'm not the youngest NP out there, I want to make sure that I'm ready to sell when it's time. And, it could be 5 years, it could be 10 years. It just depends on how I feel and how the business is going. But I love what I do every day. I don't feel like I'm going to work like I used to. I come in here with a smile on my face and I leave with the same smile. I have as much energy at the end of the day as I do when I get here. So I really do love what I do, and I wouldn't change it for anything.
I love that so much. So what's something fun or surprising about you that most patients or colleagues don't know?
Fun or surprising? I mean, there's so many things. I don't know what I want to share.
Your choice.
Well, I mean, one of my hobbies, and I used to do it a lot more, before I went to MP school and started working every day. But I'm a private pilot, and I have my own airplane that I fly across, the United States and surrounding states from Arizona.
Oh,
so I love flying.
And if you weren't an NP, what would you be doing?
Well, that's another good question. I don't know. Before I was an MP, I was hanging out and kind of managing a few different businesses and helping people buy and sell businesses. I really love that. I don't know. That's a good question. I love what I do, so I can't really see myself doing anything else at this point. I don't want to do anything else.
I'm with you. I don't know what I would do if I didn't have if I wasn't an MP. So, is there anything else that you want to tell our shared audience that maybe I forgot to ask you?
I don't know that there is. I think I'm really happy working with other vendors and people out there. Networking is great. Network with other NP-owned practices just to learn what you don't know, or to confirm that what you're doing is actually the right thing, and that other people have been successful doing the same models. I think it helps a lot to talk and network with other owners to make sure that you're in the right direction. And you might find that they're doing something that isn't working very well and that you've experienced, and you can help them say, hey, I've seen this before. This is what I did and it really helped. Or you might learn the same from them. Working with companies like Duet is, I have a business background and I'm confident doing the bookkeeping and the data analytics and looking at all that. But it's nice to have somebody else on your team that can do some of that heavy lifting so that you can focus on taking care of patients. So just because you can do something doesn't mean you should do something. We were all nurses before we were nurse practitioners. We can all take vital signs and do blood draws. But if you can see a patient while somebody else is doing that next patient, you're going to be able to take care of more people overall.
100%. You said so much there. I mean, the first part of what you said was like, breaking out of the silo. I agree with you. It's one of the things I love about Duet also. My practice uses their services, but also just being part of like a community, not just of NPs, but of NP entrepreneurs, NP business owners. It's just different. And, I don't know another space that has that. So I agree with you. Being able to kind of bounce those ideas off each other is great. And then to your other point, which 100% is true, working at the top of your license. Just because you can do it doesn't mean you should do it when you're trying to maximize your time and your profitability. I love that so much. Frank, this was amazing. I love how enthusiastic you are about your practice. It's very clear that you love what you do. Thank you for being on this podcast. I know it was your first. You did a great job.
Thank you. I appreciate it.
Well, that's a wrap for today's episode of Unsung. If this inspired you, share it with other NPs who need to hear it. Don't forget to subscribe and leave a review. It helps more NPs find us and fuels the movement. Want to join the largest NP practice network? Learn about Duet on our website, joinduet.com. Until next time, keep pushing boundaries and proving what NPs can do.